Hi, I'm Eric Payne. I'm a pediatric neurologist at the Mayo Clinic Children's Center. I specialize in epilepsy and neurocritical care. Seizures are very common in children who are admitted to the ICU and in the neonatal ICU. Most of these seizures are completely subclinical, meaning that they have no clinical signs. And so the only way that we can pick up these seizures is with the use of an EEG machine. EEG stands for an electroencephalogram. Similar to an EKG, which most people are familiar with, which we put stickers on a patient's chest to detect the electrical activity of the heart. An EEG is the same thing for the brain. So we put stickers on the surface of the scalp, which picks up the electrical activity of the brain. And that helps us give some insight into how healthy the brain is while these children are in the ICU. The other thing it does is help us pick up seizure activity. And it's the only way that we have right now to pick up these subclinical seizures. The importance of picking up these seizures is that we know that the more seizures you have in the ICU, the higher chance for having brain injury when you get discharged from hospital. So the hope is that we can detect these seizures and subsequently treat them, therefore lead to better outcomes for kids. The other thing it does is that a lot of these movements that we see sometimes in the ICU and in the NICU are not seizure activity. And so with the use of EEG, we can determine what is and what isn't seizure, and then avoid some of the medications that can be harmful and lead to overtreatment.